Dr. Gregory Thoreson is a board-certified urologist with urology clinics in North Texas. He received his Doctor of Medicine from University of Texas Health Science Center in San Antonio and completed his residency at the University of Texas Southwestern Medical Center in Dallas. Dr. Thoreson specializes in treating a wide variety of urologic conditions in both male and female patients, including kidney stones, enlarged prostate, urinary incontinence, erectile dysfunction, and low testosterone. We have a lot of great content to cover tonight, so I'm going to pass the floor to Dr. Thoreson.
All right. Good evening, everybody. Thank you for taking the time out of your evening to join us. Tonight, we're going to be reviewing a number of topics, but for the most part, focusing on a condition called benign prostatic hyperplasia. We go into the details about what it is, how it starts, symptoms associated with it, as well as treatments as well. So we're just going to start with a quick anatomy review. So the prostate is a male reproductive organ. It produces the fluids that transport sperm during ejaculation. For the most part, when you're a younger man, your prostate starts out somewhere around 20 grams or so. And then over time, most men, and we'll get to some of the statistics on this, will experience some benign growth of the prostate. We'll kind of talk about those details. They describe it as a walnut-sized gland at the base of the male bladder, and it's an interface in between the urethra and the bladder. It essentially surrounds the urethra and is somewhat shaped like a donut, if you think about it like that. So the part where we run into issues is that inner channel of the donut when things sometimes become compressed in there. So, each of these three conditions that we have here on the screen, BPH, prostatitis, and prostate cancer, all affect the prostate differently. For right now, we're just going to focus on enlarged prostate, or in other words, benign prostatic hyperplasia. So if you break down the word, it's an acronym, like many things we talk about. So it's a benign condition, and it's of the prostate, so we say prostatic, and then hyperplasia. So that just means a proliferation of cells. Normally the adult size is somewhere around 1.5 inches in diameter, and benign prostatic hyperplasia or enlargement can lead to bladder outlet obstruction, and that can lead to lower urinary tract symptoms. So this question comes up all the time about the relationship between benign prostatic hyperplasia and prostate cancer. So, there's a couple maxims here on this where it says that BPH is not prostate cancer. And yeah, of course, that's true. And it says BPH does not cause prostate cancer. And it is not felt to be carcinogenic at this time. And it says BPH symptoms are similar to those of cancer. And, it's true, but you need to kind of take that with a grain of salt. Those are more advanced cases of prostate cancer. Most prostate cancer is actually kind of detected earlier through screening. When it goes into later stages, you could actually have obstructive urinary symptoms associated with it. And then this is the part that I think is probably the most important. It's that BPH and prostate cancer can happen at the same time, or synchronously, as we say. And then when we talk about screening for prostate cancer, the test that we've been using since the late 80s, early 90s is the prostate-specific antigen test. And that test alone is actually not specific for prostate cancer. It includes prostate cancer, but it also includes things like benign prostatic hyperplasia, as well as prostatitis, just like we had talked about on that initial slide. So PSA levels are helpful, but they don't exclusively help for this condition itself. So, when we talk about a normal versus an enlarged prostate, what we're really getting at is actually the compression of the inner channel of the prostatic urethra. And as you can see on this diagram, with the enlarged prostate, you do see that extrinsic compression of that inner luminal channel of the prostate. And that's where a lot of the therapies that we're going to be talking about tonight are directed towards. So, one of the statements on here about, the prostate size does not correlate with the degree of obstructive urinary symptoms or severity of symptoms. I think that that's absolutely true. And it's one of those things that's somewhat counterintuitive. You wouldn't necessarily think that at first, but that definitely is true. So we really do try to focus in on patients' symptoms when we start talking about treatment. Size alone isn't kind of kind of a requirement for treatment. So when we talk about symptoms of benign prostatic hyperplasia, the classic thing that we're talking about is a weak urine flow. All the other things that we were talking about here, like frequent urination, sudden urge to urinate, yes, those are true that they're within the complex of benign prostatic hyperplasia, but those are actually managed independently of this. And we're just going to be focusing on treatments for, growth of the prostate or benign prostatic hyperplasia. Some of the other symptoms are managed a little bit differently, but they are managed in a synchronous fashion to the management of benign prostatic hyperplasia. So when we start talking about benign prostatic hyperplasia, it's an incredibly common condition, but it's also one that does affect men's quality of life. And as you can see from some of these statistics, it also affects their loved ones as well too. So it really is a condition that does interfere with, kind of the normal aspects of your life. One of the other things that they focus on with these statistics that they show is the rate at which there will be some sexual problems associated with the management of lower urinary tract symptoms, as well as just the condition itself. Some of the therapies that we're going to be talking about tonight actually do a really good job of preserving sexual health in the form of ejaculatory function. Luckily, for the most part, most benign prostatic hyperplasia treatments do not affect erectile function. It's mostly ejaculatory function. We'll kind of get into that a little bit tonight. So when we start talking about benign prostatic hyperplasia and who gets it, it's generally reserved for men who are 50 years or older. And one of the statistics that we talk about most frequently is that if you live long enough, it's almost a certainty that you will have some form of obstructive urinary symptoms. And from this statistic from 2010, about 14 million men have lower urinary tract symptoms associated with benign prostatic hyperplasia. And this is also an important point to kind of drive home, is that things like obesity, higher BMI, the lack of exercise may increase the risk of benign prostatic hyperplasia. So many times here in the office, we really do focus on things like trying to optimize cardiovascular health for things related to erectile dysfunction, but it does cross over for prostate cancer and benign prostatic hyperplasia. So how do we diagnose an enlarged prostate? So we do a prostate exam. The digital rectal exam specifically is what they're talking about. We also do PSA testing, but that is more for prostate cancer screening, but we do take that into consideration. Excuse me. We also do assess voiding velocity, so that's the peak urinary flow, as well as a post-void residual volume testing. So one of the other things that we focus on too are questionnaires that we do here in the office, and it's the AUA symptom score or the IPSS, as well as the quality of life questions within that as well too, are what we focus on here in this office. So when we start talking about treatments, we generally start at the very beginning, where we try, conservative measures as much as possible. A lot of what we do with fluid and diet changes are more for management of waking up at night to urinate, or nocturia is the other term that we use for that. We also sometimes use things like Kegel exercises and bladder retraining. I don't really spend that much time on that, because a lot of times that is managed, I think, at home with men prior to coming in here, but sometimes we do talk about that. And then many men focus just on medications for benign prostatic hyperplasia. And this is probably an old statistic, but somewhere around 80% of men do feel most comfortable just with medications on that. When treatments like Resume, and as this is referring to the permanent implants, would be UroLift, it was a bit of a paradigm shift for us, where we do have minimally invasive treatment options that we can offer around the same time as medications are being offered. And some men do find that extremely useful. And the durability of treatment for some of these, and we'll kind of talk about the durability of treatment later, is actually quite good. There's also surgical procedures, and we've had a couple advances that we'll talk about tonight that are an update from the last time we gave this talk. But the classic one that is most often referred to for surgical treatments is the TURP or TURP procedure. That's the one that is most often performed, but that is also changing as well too. So it's kind of a moving target or a changing landscape out there. So with regards to alternative therapies, this is a question I get all the time. And, we talk about phytotherapy or plant-based substances. And it really would be fantastic if there was something out there that was effective, but unfortunately, in a randomized controlled setting, these agents were no more effective than just a sugar pill, unfortunately. So we normally don't spend much time talking about those in the office. And then as we talk about watchful waiting, this is where, I think this is when symptoms generally start. Men are often kind of evaluating treatments. Sometimes we'll even start some medications, see how we do on them, and see if we're having a positive treatment effect associated with it. So this is kind of the initial stages where, we do make a determination as to whether or not, we do or don't want to start medications. And when it comes to the medications that we often start at the very beginning, oftentimes it's alpha blockers that we start. With that, the side effect profile that we talked about would be sometimes an unsafe drop in your blood pressure. That's mostly when people stand up too fast. You can also get some stuffy nose or rhinitis associated with that. Sometimes some fatigue there. But generally, this is one of the ones that we start with most common. And then we also have a drug class called 5-alpha reductase inhibitors. These are best used in men who have extremely large prostates. So anybody with a prostate size of 60 grams or more, this is one of the more effective ones that we have out there for larger prostates. It's designed to stop the growth or shrink the prostate. And this is the one that a lot of people, I feel like, have questions about, because this is also similarly used for male patterned hair baldness as well too. So you sometimes hear about this drug class from that. One of the most notable side effects is the erectile dysfunction that sometimes comes with it. And you also have potentially some other ones, other side effects like lowered sex drive and ejaculatory dysfunction with breast enlargement. Those aren't as common, but can happen. So what is Resume? Resume is outpatient therapy that we do here in the office. And we're going to go through a video so you'll see the mechanics of it. But one of the reasons why I've essentially exclusively converted over to Resume therapy over some of the other minimally invasive treatment options is, this right here, the surgical retreatment rate. And, we have actually seen that to be true here in the clinic, where I do feel like the retreatment rate is extremely low. And, when we start talking about durability, this is one of the best that we have out there. So it really is a good treatment option. And, the other thing that is great about it is that there's good preservation of ejaculatory function. So this is not without its side effects, though. It's an awake procedure that you have to do here in the office, although we do have the ability to do it in the operating room. We just don't do it very frequently because it just doesn't come up all that often. But you can have some kind of painful urination. That's kind of a common side effect that we see, as well as some urgency that takes place. A urinary tract infection is possible. We often try to pre-treat for that kind of stuff. And then there are rates of urinary retention, but luckily that's not all that common as well too. So let's go into the mechanics of it, kind of how it all works. So you'll see here just a quick video. The diagrams that we have here would be the before, and that's that inner channel that we were talking about that has that compression, and then the after effects. And this takes place, a period of weeks afterwards. I think maximally it's somewhere around 4 to 6 weeks afterwards, but we do see some pretty near-term treatment effects as well too, that we can see where we do get some early relief on that. So let's walk through this video real quick.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume Therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
All right, and we've got one more video on this topic, and this is just a patient, review of it.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Resume procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Resume procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Resume treatment has made a very big difference in our life.
All right, so I briefly talked about the prostatic urethral lift procedure, and it came out around the same time that Resume came out, and I personally did a lot of these procedures previously, but when the long-term data came out, I wasn't as enthusiastic about it, where, when we talk about the retreatment rates, it unfortunately is a little bit higher than we want it to be. So, we talk about the rate of retreatment as being somewhere around 1% per year, and then this will be, kind of quite a bit higher than that rate of retreatment here. So one of the downsides to the prostatic urethral lift is that, unfortunately, there's a permanent implant that's in there too, and it does interfere when we start doing prostate cancer screening. Sometimes we do have to remove these implants out down the road as well too. And these are some of the side effects as well too, which is actually pretty similar to a lot of the treatments that we had talked about, except for the urinary stones. That one is a little bit unique to this procedure itself. And then we're also going to talk about green light laser therapy as well too. So this is a photo vaporization of the prostate that we do. So that's where we apply a pretty high intensity laser to the prostate, and it is absorbed almost exclusively in prostate tissue. And with that, we do cause vaporization of that tissue. And we have certain kind of orders that we follow within for the resection, and we'll kind of show you a video on that here in just a little bit. But these are the side effects associated with it as well. All right, so one of the other ones that we talked about at the beginning of the lecture was just the TURP procedure that we do. This one is actually one of our oldest procedures. I think it's going on close to 100 years now that we've been offering this. And obviously it's gone through iterative changes. It is a good procedure. It's generally done in something like less than an hour or so, and then you get to go home afterwards. And you have a catheter that stays in overnight on this. One of the good things about a TURP procedure is that we actually do have some tissue that we can send off. So when we start talking about, just making sure you didn't miss any prostate cancer, this is a good way to make sure that if you have any concern for prostate cancer, although it doesn't normally occur within that transition zone, like where the hyperplasia of the prostate occurs, it's still comforting to be able to send that off and just make sure you don't miss anything. So that's one of the kind of benefits to this that we don't always get with some of the other treatment options. The side effect profile is actually pretty similar to a lot of the ones that we had talked about tonight. So it's kind of in line with that. And then the retreatment rate is about 1% per year. This is showing a little bit higher than that, but I normally quote something just around 5% at 5 years is what we say. So for prostatectomy, this is specifically prostatectomy for benign prostatic hyperplasia. So we call it a simple prostatectomy rather than a radical prostatectomy. We generally reserve this more for men with extraordinarily large prostates. So that's generally prostates that are 80, maybe even 120 grams and higher, is when we normally talk about doing a simple prostatectomy. It is also nice in that you get to send that tissue off for evaluation, but we do have quite a bit more bleeding on this type of a procedure, although often it's done robotically now. So the rate of bleeding and rate of transfusion have gone down quite a bit from that advancement. And then this is one of our newer therapies that has come out. I haven't personally used this yet, but I have had a couple of patients ask about it. This is an implant that is placed, it says that there's no general anesthesia associated with it, but I believe that we do wind up actually using anesthesia for the implant, and don't hold me to that, but that's my understanding of it. And then you do take the implant out after a period of 5 to 7 days here in the office. And that's how the iTind device works. And then we have the aquablation therapy. This is a procedure that does require general anesthesia. It's a pretty similar surgical retreatment rate to the TURP procedure. This uses a kind of autonomous robot under ultrasound guidance to resect the prostate tissue just through kind of a high pressure water jet. Most people do pretty well with this, and there is pretty good preservation of ejaculatory function in my experience with this. Generally people do well, but we are still in the hospital for a period of time afterwards. On average, it's been 1, sometimes 2 days on something like that. But it is a good resection, and unfortunately you don't really have any tissue that you can send off for evaluation on that one. So tuna is a procedure that's been done for a long period of time. I haven't personally seen this procedure, but I've heard of it. But it does have an extraordinarily high surgical retreatment rate. This is one of the highest that we have talked about tonight. So in summary, you know, what is the prostate? How does it work? Hopefully we have kind of a better understanding of that tonight in terms of all the different treatment options that we kind of go through. You know, there's the initial part of just, you know, assessing symptoms, seeing what we do, seeing how people respond. And then we start walking into, you know, certain medical therapies. We do talk about the introduction of either Resume or the Urolift procedure or permanent implants. And then we do have the traditional surgical procedures as well too. So that's kind of a quick high-level summary of what we had talked about tonight. You know, again, this is not really meant to serve as a replacement for medical advice. You know, we just ask that you consult with your urologist to determine which therapy is best for you. So these are the references here. Some of the disclosures that they have. And then I think we're going to open this up to any questions that we might have.